are now joined via Zoom by San Luis Obispo County Public Health Director Dr. Penny Borenstein. The FDA just authorized a second booster shot of the COVID vaccine to be given to people 50 and older. That decision fueled by the rapid spread of the BA.2 subvariant of Omicron. So, Dr. Borenstein, what's your advice on booster shots here, and what have we learned about this new subvariant?
So the subvariant is more easily spread than the last variant, but it doesn't seem to be more severe. So if you got the BA.1 or the Omicron variant before, you're pretty well protected. If you don't believe that you've gotten it, or even if you have, a booster dose is not going to be harmful. But especially those who have not had COVID-19, the disease, it would be recommended for anyone over age 50. And also I would add for anyone over age 12 who has high risk, any medical conditions that puts them at higher risk for bad outcomes from the disease.
Now, I also just read a while ago, I'm one of those people who got the J&J vaccine, which has proven to be not quite as effective. They recommend when you get a booster to get the Pfizer or the Moderna. And I believe that I'm eligible to get a booster as well. Those people who got the J&J, is that your understanding as well?
Yeah, that is absolutely correct. No matter what type of vaccine you got previously, now you can get either a third dose or a fourth dose if you started with the J&J or another type.
And we just heard it in the report in the last segment, there's a discussion of more funding for COVID from the federal government. Has any of your funding from the federal government dried up, and do you have any concerns about being able to provide all the COVID-19 services that are needed going forward?
Our funding at this time is solid. We anticipate being good for at least a couple more years. We hope that we won't need it all, that we can give it back to the taxpayers if we don't use it, but we feel solid with our funding that we have now.
Okay. As COVID cases have dropped, have you been able to focus more attention on other public health projects? COVID certainly had to be all-consuming for you for long stretches of time over the past couple of years.
Yeah, my schedule has lightened up a little bit. We still meet on a regular basis with my COVID team, but we're turning our attention to our community health improvement planning and all the other things that we do in the public health department, which are many.
And COVID cases are down right now in SLO County. Give us an idea of where we stand today.
Yeah, we've been pretty steady for a while now, for at least a couple of weeks. Our hospitalizations are low. We're even seeing our deaths slow down at this point. So everything seems to be good, and that's notwithstanding the news that everyone's hearing about the new subvariant BA.2.
Thank you so much for taking the time to update us.